Hello everyone. Thank you so much for joining again today. You now probably know who I am if you were with us yesterday. I am Thulani Saizi. If you missed our session yesterday, the recording will be uploaded on YouTube on the Junior Techies channel. How do you access it? You simply need to go on YouTube and search for Junior Techies and you have access to the video. Guess what? We're still going on with the hashtag I want to be a vet. So you may still take a picture of yourself, with your lovely pet, or if you do remember what we were taught yesterday, you can take a picture of yourself practicing or doing one of the kettle rope knot. We are so excited and we can't wait to see those pictures. Please do post the pictures on Twitter and don't forget to hashtag I want to be a vet. Please take note of the following. I will give out the voucher code at the end of the session. And this is very, very important. You have to complete the survey at the end of the session. How do you access the survey? There is a survey tab on the screen. You simply need to click on it and complete the survey at the end of the session. This is very, very important for us, so please don't forget to do the survey. If you do have questions for us, you are more than welcome to ask us. We'll have an interactive session at the end to answer all your questions. How do you ask the questions? There is a Ask Live tab on the screen, so you simply need to use the Ask Live question tab, which is right next to the chat tab. But if you do want to interact with us and get to know us more, you can use the chat tab. So please take note of this. If you want to ask questions, make use of the Ask Live question tab. Last but not least, please do follow us on our Instagram account at OPVSC. With me, I have Prof. Holum, and I'm going to leave this time to him.
Thank you, Thulani, and thanks for everybody joining again this morning. I hope you all enjoyed yesterday's session with all the great videos and all the time that we spent with Dr. Kate and learning about knots and so on. And today we've got some great videos waiting for you. There's one particular favorite of mine, which I won't spill the beans now, but you'll see later on today. There's one great video coming up. So enjoy the day with us and remember to ask questions. If you have any questions about entering our programs at Onderstepoort, please ask them on the chat, and we will have another session later on where I will be answering those questions specifically. So enjoy the rest of the program.
Now we'll be having a look at the introduction video made by OPVSC. OPVSC simply means Onderstepoort Para-Veterinary and Veterinary Student Committee. Enjoy.
Welcome to our annual I Want to Be a Veterinary Profession weekend. This initiative was started with the main aim of exposing high school learners to the veterinary profession. We hope that one day we will therefore have more veterinary professions in communities.
During the course of the day, we will be showing videos based on our curricula taught at Onderstepoort campus. This includes animal handling and certain facilities. We will be taking questions at the end of the session.
Good morning, everyone. I hope you all had a relaxing Friday evening and that you're all up and ready for our sessions today. Next up, we have a video on dogs.
Hi everyone, my name is Alex Jordan. Are you aware that some dogs have such an incredible sense of smell that they can detect medical problems in people? If only they could tell us what they are feeling when they are sick to help us figure out what's wrong with them. But unfortunately, as much as we wish our patients could talk to us, they cannot. And that is why we need to learn how to do a thorough clinical exam. Liane Huber, the OPVSC academic rep of 2021, will be demonstrating how to take the vital parameters of a dog, as well as how to perform a basic clinical exam.
In this video, we'll be showing you how a dog is handled in a clinic to perform a clinical examination and how to take vital signs. Firstly, we have to ensure the safety of everyone as well as the patient. We approach the patient calmly and confidently. Never leave the patient unattended on a table. We will now start the hands-on examination by looking at the vital parameters. This is commonly referred to as recording the TPR. TPR stands for temperature, pulse, and respiration. The body temperature is measured rectally, and a normal temperature ranges from 37.5 to 39.5 degrees Celsius. Next up, we measure the pulse. We need to locate the femoral artery, which runs on the inside of the hind leg. After we locate the artery, we palpate it with our index and middle fingers for a minute. The normal range in adult dogs is 80 to 120 beats per minute. Heart rate is usually determined at the same time as the pulse rate. We place the stethoscope on the left side, between the 5th and 6th rib, and when we lift the leg, slightly behind the elbow. Here we can hear 3 of the dog's 4 heart valves, which are called pulmonary, aortic, and mitral, or PAM. The 4th heart valve, the tricuspid valve, can be heard on the right side. For every heartbeat heard, a pulse should be felt. We evaluate the dog's respiration in 2 steps. We observe the animal while it is breathing, and after that, we listen to the lungs with a stethoscope. The normal respiration rate is 15 to 30 breaths per minute. The hydration status is another parameter we look at while taking vital signs. To determine this, we pinch a skin fold between the thumb and index finger and lift it upwards. This is usually performed on the top of the neck area. If the patient is not dehydrated, the skin will go back to its normal position within 1 to 2 seconds. We can also observe the mucous membranes to determine the hydration status. We look at the mucous membranes of the mouth or the eye. The mucous membrane should be pink, moist, and glistening. While we lift the upper lip of the mouth to observe the gums, we can also determine the capillary refill time. The capillary refill time aids in determining the perfusion of mucous membranes. We measure it by pushing down on the upper gums for a few seconds until that area turns pale. We then release the pressure and observe the time it takes for the depressed area to regain normal mucous membrane color as blood flows back into the area. The normal capillary refill time is 1 to 2 seconds. After we recorded the vital signs, we can continue with the clinical examination of the entire patient. It is performed to examine the various body systems. We follow a systematic approach where we usually start at the head and work down towards the tail to ensure that we do not leave anything out.
Hi guys, so hopefully you guys remember me from yesterday. If not, I'm Jane Akesa and I hold the portfolio of Vice Chairperson. I'm also in charge of community engagement as well as social media. So the next video that we are going to play is the Skills Lab video, which is the place that we are currently in. But before we get to that, I'd just like to have some guesses from you. So if you guys can just take a guess on the chat box, how many skills do you learn in the Skills Lab throughout the course of your BVSC or your vet degree? You can just let me know in the chat box. I'll let you guys know if you're right, if you're not right. Okay, we are running a bit out of time, so I'm just going to let you know in any case. So the amount of skills that you learn in the skills lab is 73. So you learn 73 different types of skills, and these are part of day one vet skills that you need. So as soon as you graduate, you need to be a perfectionist in all of those skills. Okay, on that note, I'm going to be playing the skills lab video next.
Hi, my name is Jean-Pierre Chitta.
And I'm Jaina Kesa.
At the Faculty of Veterinary Sciences, we pride ourselves in having a world-class skills lab.
This is used for various training practices in the veterinary profession. Over here, we have what we call our breeding Betsy. This is used to estimate ovary size as well as detect any abnormalities. Let's have a look at the 2021 Skills Lab video with Leonie Hubert.
The purpose of our Skills Lab is to allow us to practice our techniques on training models before we do them on live animals. This gives us some added confidence and competence when doing the procedures on live animals and reduces the risk of harming the live animals.
This is the haptic cow model. It is the most high-tech model that we have in the Skills Lab at Onderstepoort. And I'm going to demonstrate how this works. So first of all, I start by putting a rubber thimble on my finger, and then I insert my hand into the model. And on the inside, there's a device that I have to connect my finger to that will control the movement of my hand so that it will train me how to palpate, how to do a rectal palpation on a horse or on a cow. And then on the computer, I've got different settings and different options. Let's start with the haptic cow. So the first thing that I'm going to do, as you can see on the screen of the computer, is that the computer will teach me where to find the edges of the pelvis in a cow. And there my finger goes over the brim of the pelvis into the abdomen. And you can see how the computer controls my hand, so it stops me when I try to get too far, and it shows me where are the edges of the pelvis that I can palpate. Palpate means I can feel with my hand inside the animal. And then I go to the next level here, which is the cervix, the start of the female reproductive tract. And now the machine will guide my hand and will teach me where the cervix is in relation to the pelvis of the animal so that I can feel. And when I go to a real animal, I've already familiarized myself with where to find the structures. And so we can carry on and we can simulate many different things like disease conditions. There's an example of endometritis, which is a disease condition that cows get after calving sometimes. And I can feel what that should feel like. And also pregnancy diagnosis, or finding the ovaries, many other settings that we can do here.
We've got various training facilities. Here we have students practicing suturing. These are our horse aging models. Here we learn to identify the age of a horse by looking at the teeth. We've got additional facilities that we use to further our studies. This facility has preparation tables for drawing up injection, sperm collection, a bull for injection sites and intubation, cats for diagnosing hydrothorax and performing thoracocentesis, a cow for practicing epidurals, and a table with some surgical equipment to practice with. This is our clinical pathology room in the Skills Lab. This facility includes X-rays, hematology, bandaging, body condition scoring, placing IV catheters, and urinalysis.
Hey guys, welcome back to day 2 of I Want to Be a Vet. In today's session, we have more videos for you guys. I hope you guys enjoyed yesterday. And if you missed yesterday, do not be alarmed because the video will be uploaded. For those of you who don't know me, my name is Naishi Munyeki. I'm in 4th year. I'm the secretary and treasurer of the OPVSC. And I'll be taking you guys now to the OVA clinic, or the hospital basically. So my question now is, what does OVA stand for? For those of you guys who are watching, can you type it quickly on the chat box as we're about to head out to the hospital now.
The only one of its kind in South Africa, Onderstepoort Veterinary Academic Hospital takes pride of place within the University of Pretoria's Faculty of Veterinary Science. It offers comprehensive, affordable treatment to furry, feathered, and scaled patients, including pets and wildlife of all shapes and sizes, 24 hours a day. You can be confident that all our patients are in caring and competent hands of qualified experts assisted by enthusiastic, attentive students under professional supervision. The facility is a center of excellence, with specialists covering an unrivaled variety of disciplines all under one roof. We serve the community through our location visits to help care for those who can't do so themselves. Each case becomes a model of best practice, clinically and ethically, with treatment based on scientifically proven research and knowledge. The experience and expertise of the specialists can also provide innovative solutions to unusual problems, and when an inside view is needed, digital radiography, ultrasound, computed tomography, and nuclear imaging are available to facilitate diagnosis. No matter whether you're big with a routine little problem or tiny with a big ache, you'll always be welcome at the Onderstepoort Veterinary Academic Hospital, and you can be sure that you'll receive the best care possible.
Hi everyone, I hope you all enjoyed that video of one of the best animal hospitals in South Africa. I'd just like to give a shout out to Janneke for posting a photo of her Yorkie. It looks really comfortable in that pink bag. So I hope you guys enjoy. We're going to be having a quick break and then we'll carry on with our next of our sessions.
Hey guys, welcome back. I hope you guys enjoyed your break. You got your snacks, your drinks, and you're ready to go. So now we're gonna have an interactive video with Sister Ntabiseng, and Tulani will also be assisting us. So I hope you guys enjoy and you learn a lot. So pay attention and take notes if you can. Sister Ntabiseng, the floor is yours.
Hi guys, welcome to the I Wanna Be a Veterinary Professional live broadcast all the way from Onderstepoort. I'm Sister Ntabiseng Managa all the way from Sosha, and today I'll be showing you how to do a bandage. We're first gonna start with a thoracic bandage on a dog. Okay, so this is my patient Keisha, a 7-year-old female intake presented to us with a dog bite wound on the left thorax. And I have my student here, Tulani, who's gonna help me hold our patient. Okay, so before you do a procedure, a bandage, you just need to make sure that you have all your stuff set up and ready. So remember also, when working with an open wound, always have your gloves on. Okay, so I have my gloves, so all bandages have 3 layers. We have a primary layer, secondary layer, and a tertiary layer. Your primary layer will be the layer that will go directly onto the wound. So I have my non-adherent and my adherent dressing on the table. I have my secondary layers, which are my soft band for cushioning and for a nice padding, and I also have some crepe, which is also a secondary layer, and I have elastoplast, which is my final and also my tertiary layer. Okay, we're gonna start now. Okay, so this is Keisha presented to us with a dog bite wound on the left thoracic. I'm sure you can see the wound there. Okay. I'm gonna start with my primary layer, which is the layer that goes onto the wound. I am using primer pour. Stick it onto my wound. Can we turn them? Okay. Nicely stick it onto my wound. Just cover my wound. Okay. And I come to my secondary layer, which is my soft band, for nice padding and cushion. So with your secondary layer, we always overlap with 50%. We do a 50% overlap, okay? So I'm gonna throw 2 throws around my thorax. Make sure I nicely secure and also protect my wound. And I'm gonna go, so with the thoracic bandage, it's a figure of 8 bandage. I also call it the crisscross bandage. So I'm gonna go around the thorax, as you can see, over the shoulder, under the leg, around the thorax again, over the shoulder, under the leg, around the body, over the shoulder, and under the leg. So as you can see, it's a crisscross figure of 8 bandage, and my wound is nicely covered with the soft band. Okay. And then next, I'm gonna use my crepe bandage, which is also a 50% overlap. Around the thorax, same as the soft band, 2 throws around the thorax, under the leg, over your shoulder, around the thorax, over your shoulder, under the leg. And also remember, with your thoracic bandage, that you do not make it too tight, because you don't want to compromise your patient's breathing as you're working on the chest. Okay, over and there. Okay, I'm just gonna secure my end, the end of my crepe, with a piece of micropore. Okay, there. That is my crepe, my secondary layer. And then next, it's my tertiary layer, which is the elastoplast, the final one. It's also gonna be the same. 2 throws around the thorax. It's a bit sticky. Okay, you also don't want to make it tight, otherwise you compromise your patient's breathing. Okay, sorry, it's a bit tight. Okay, I'm just gonna take off my gloves because gloves and stickiness don't go together. Okay. Under the leg. And also it's very important to re-roll your elastoplast before you do bandage so that it doesn't become too sticky and makes the work more difficult. Okay. Okay. Around the thorax. Make sure you cover all your layers. That is your soft band, your crepe. Okay. And I'm gonna end my bandage here. Okay, there you go. Let me see on the other side. Just make sure everything is nicely tucked in. And just to check if your bandage is not too tight, you need to be able to pass in 2 fingers on both sides of your bandage. So do you want to check on that side too, Lani?
Yeah.
Just, is it fine?
Yep.
Yes. And that is our thoracic bandage. Done.
Thank you, Sister Ntabiseng.
Okay.
So now we will be coming to do our blood smears with Thulani, and he will be doing the blood smears and I'll be narrating as he does the blood smears. So first we have our slides. Thulani will show us the slides. These are our slides and we need to clean them before we use them. And then we have, there is cleaning the slides with a piece of tissue. We have our stains that we use to fix the blood smears. We have our alcohol fixing stain, we have our eosinophil stain, and our basophilic stain. And we have our spreader slide, pipette, which we'll be using to draw blood from the EDTA tube. And then we have, of course, our EDTA tube that has the blood. But this is not real blood, it's just to illustrate how to do the blood smear. And a blood smear is one of the first things that you need to be able to do in the field and in practice, because you can get to diagnose a lot of diseases without having to put yourself at risk and the staff that you work with, because we might have some zoonotic diseases. So blood smear is very important to be able to do and learn, so you can take the blood and look at the microscope and see what you might be dealing with. So Thulani will start the procedure. First, you take your blood, you're gonna mix it by just twisting the EDTA tube, because we know blood has got a lot of compartments, and it's not just blood, there's like serum, there's platelets. You wanna make sure that they don't sediment and then they filter out, so you wanna mix everything all together. Once it's done mixing that, you're gonna draw some blood on with the pipette and put on the slide. The trick with the blood smear is you don't want to use too much blood. So when you use too much blood, you don't get what you want to see on the blood smear, because there'll be a lot of blood. So now, the first one, we just want to show you what happens when you use too much blood for your blood smear and how it affects the quality of the blood smear. So you're going to take your blood and put like a drop on the slide. Take your spreader slide. So you want to put the spreader slide at a 45-degree angle to the floor, perpendicular to the floor on the slide, and then you're gonna touch the drop of blood, and then with one swift movement you're gonna drag the slider across the slide with the blood. And yeah, so there it is, dragged it. Now it's gonna show us what happens when we have too much blood. The slide is just full of blood. We don't see what's going on. We don't see the blood cells and what is on inside the blood cells. So that is what happens when you use too much blood. So the trick is to try and use a small drop, just enough so you can see what's going on. So now we're gonna try again with the proper amount of blood this time. Hopefully, Tulani. Hopefully. But this is it's a skill that takes practice, I must say. You get people who get it first time. I know for myself, it took me a while. I don't know how many blood smears I had to do until I could eventually get like the right one and the right technique. So it takes time. So it's something you practice, like driving. You don't just rock up and start driving a car. You need to practice it. So blood smears are also one of those skills that practice makes perfect. So now we're gonna try again and make another blood smear for us. Great. So now with the blood smear, we want to dry it, because what we're looking for in a blood smear is that feathered edge towards the end, because that's where we see the filtering of the blood, and we can get to see the red blood cells properly. We can get to see if there are any parasites we need to be looking out for or anything like that. So once we have the slide, we can dry it like this, or you can also use a hair dryer to make the process quicker so that you can actually get to staining the blood. So once you've dried the blood, we can go back to our stains, which are very important. So we take the fixing stain, and the slide goes in there for 2 seconds. So usually you dip it twice and make sure you cover the blood on the slide, and then you clean the slide on the tissue, and then from there you take it to the eosinophilic stain, and then with that one you dip it for 6 seconds. So we take 6 dips inside, and then we clean it again on the tissue, and then we go to our basophilic stain, and then that one we go for 40 seconds. So you just dip it 40 times, and then from here you then rinse your blood on a tap. We use like low streaming water. You don't want to wash off your slide. You just want to rinse off the stain that is in excess, because now we've fixed our blood smear and we have stained it. So once you rinse it, you just let it dry, and then you can take that slide to your microscope, which we have here in the skills lab, and then you can get to see what your patient has in terms of like babesia or other intracellular parasites that affect your blood. And then that's how we do a blood smear, which is a great skill to have as a vet or a vet nurse, because it helps you in the field. So now we're going to go back to Assistant Tabiseng, and she'll be helping us with the second bandage with our second patient.
Okay, so the second one will be a foot bandage. Just gonna move Keisha. Tilani, can you please help me? Yes, Keisha. Okay, so this is one of our patients that was presented to us with a wound on his foot. His name is Bobo. Okay, remember also, when working with wounds, always put on your gloves. Okay, so we're gonna put Bobo on his right lateral side, just so I can get access to the injured foot. Okay, so Bobo has a wound on the left foot, so I'm just gonna place a bandage here just to cover the wound. Okay, Gonna use my dressing to cover the wound. And I have my gloves on. Okay. It's just 10 bobo. Okay. So same principle, primary layer, secondary layer, tertiary layer. Primary layer on bob, I'm gonna use a gauze swab and just stick it nicely to the wound. Oh, please hold it for me like that. Gloves and sticky tapes don't go together. Okay. Okay, my foot is nicely covered, my wound is nicely covered. So I'm gonna start. Okay, just our secondary layer, soft pen for cushioning. Also remember a 50% overlap. So your soft pen is 50% overlap, and your crepe is also 50% overlap, and your tertiary layer is a 30% overlap. Okay. Nice and firm on the foot. Okay. And remember to also, when doing a foot bandage, just to include the joint, the upper joint, so that your bandage doesn't slip. Okay. Next layer is gonna be my crepe, which is still also my secondary layer. So with this bandage, you just need to make sure that you don't make it too tight, otherwise it's gonna interrupt your blood circulation. Okay, so not too tight, just nice and firm. Remember 50% overlap. You don't want to cut off your blood supply, because if you make it tight, that's what's gonna happen. Okay. Okay, my scissors. Thank you. Can you please hold there for me, Tulani, on the bandage? Okay, and where's my sticky stuff? Okay, it's fine, I'll use this. Okay, and I'm gonna secure my crepe. So it's kind of gonna look like a boxing glove, okay? And then my final layer. Okay, before the final layer, sorry, we need to put enough cushion at the pad here. So you wanna put enough cushion on your foot pad. Can you please hold on for me? Just to protect your pad, your foot pad, and then nicely secure it. You can either secure it with 2 strips or 4 strips of Elastoplast. Doesn't really matter. Can you see? Thank you. Okay, and then my final layer, my tertiary layer, which is the Elastoplast, 30% overlap. So as you can see, it looks like a boxing glove. Okay. Remember, not too tight. You don't want to cut off your blood supply. Just gonna go around at the bottom again. Okay. Okay, done. My wound is covered and my leg is nicely stabilized. And that's it from me today with the bandages. Thank you.
Thank you so much, Sister Ntabiseng.
Okay.
So now we are gonna go to Tulani, and he's gonna show us suturing patterns, which is one of the skills we learn here at the Skills Lab, where we have our suturing pad. Can you pick it up? So it's very, very helpful. It's like, I don't know, with the Skills Lab, all the specimens and the stuff we use, they are so realistic. And that's like our suturing pad, where we practice suture patterns. So to close up wounds, should we need to close them up if there are lacerations or other wounds that need closing or after surgery. And then we have our suture material, which is nylon. Then we have our instruments. We have the needle holder, the forceps. This is our needle holder. We get our forceps, and these are our forceps. And here we'll be doing a simple interrupted suture pattern for us. And as you can see, the suture material comes wrapped. It's a sterile needle. The needle is already inside. Everything in there is sterile because you don't want to contaminate or bring any infection when you're closing a wound. So we use sterile needles and the material as well. So everything comes pre-packed, sterilized. So there is our needle and material. What we usually do is once you take out the material, you want to stretch it out because it's all tangled up in there. So you want to loosen it out so that it's easier for you to suture your wound. So now it's going to grab the needle with the needle holder. And then he's going to use his forceps to handle the wound or the skin, and he's going to start suturing for us. So yeah, this is one of the many skills that you can get to practice and learn here in our skills labs on campus. It's very fun, very interactive. And you know, with the Skills Lab, you can actually come in here and speak to the sisters, and you can book your own session if you want to practice some more. As I said, like some people learn faster than others, but you have the opportunity to just come at your own time during your free time when there are sessions open to book a session, and you can sit here and practice on your own and just get the hang of it. Now he's gonna cut off the suture material. And with also suturing, you don't want to make it too tight or too loose because the wound is still healing and the tissue. You just want to bring the tissues together so that there's enough space for the animal to actually close the wound itself as well. We're just bringing the tissue so that they can heal together, and he's just going to show us what he's done. But unfortunately, I don't think you can see the material because it's a bit thin, but you can show them the suture pad. As you can see, it's closed there on one end. So that's how you suture with a simple interrupted. Basically, you suture one, then you cut off, and then you start again. That's why it's simple interrupted, because the suture is not continuous, but it's cut off, and then you do another pattern again. So that is our simple interrupted suture pattern. And thank you to Sister Ntabiseng and Tulani.
All right, thank you so much, Sister Ntabi Singh, as well as our 2 students that assisted us today. So now we're going to have the exciting part of the video, which is our bloopers. So if you have seen all the videos that the OPVSC has done, there are bloopers. Yes, students make mistakes too. So there are bloopers, and the students have not seen the bloopers yet. So this will also be our first time watching the bloopers. So sit back, relax. You can laugh at us. It's okay. We're also going to laugh at ourselves. And after the bloopers, we will be having a 5-minute break. So we'll see you after the bloopers, after the 5-minute break.
Thank you for coming with us on this virtual journey from the 2022 OPVSC! Oh, okay, we start, okay. Sorry. Our main goal is to welcome
Videos based on our curricula. Be social and cultural. Oh, got it. Let's go back to. All right.
Hi. I am Jaina Kesa. Did you know? Okay. Okay. When in doubt. Did you know?
But goats tend to quality plant pots and high quality plants. What did you me? I probeer iets afneem hier. Are not as dependent as sheep on having other.
That some dogs have such a.
On an exciting journey to meet our. Damn it. I forgot my lines. Brown and Paddy, and I'll be taking you through to meet our family of pigs. Come on, I got this. On an exciting journey to meet our family. To meet our family pigs. Family pigs? To meet our family of pigs.
Okay, start again with that whole knotting thing. Just restart with it. I'm on your hands, so you can stand there where you were standing. Okay, I'm on your hands. You can start with it now. Why is she biting you? I don't know.
And this is the wildlife clinic at the faculty's veterinary. Is the wildlife clinic at the veterinary. Is the wildlife clinic at the faculty's veterinary. Is the veterinary.
I'm supposed to start. Like, what's next?
Hello everyone, my name is Naishi and this is, my surname, sorry. Hey guys, welcome back. I hope you guys enjoyed the interactive video with Sister Tabi seeing all those bandages, the suturing, and so as well as the blood smears. So now we're gonna take a tour and listen to the BVSC curriculum video where they explain all the questions that you might have regarding the curriculums that we have here on campus. So please listen up and just prepare yourself for what you might need to be handling with, or any questions you might have. The video might just answer that. So enjoy the video.
The BVSC degree offered by the Faculty of Veterinary Science at the University of Pretoria is the only program of its kind in South Africa. This professional program is accredited by the South African Veterinary Council, the Veterinary Council of Namibia, the Royal College of Veterinary Surgeons in the United Kingdom, the Australasian Veterinary Board Council, and the Malaysian Veterinary Authority. This accreditation allows our graduates to register as veterinarians in several other countries without having to pass further board examinations. Admission into the 6-year program is possible at first and second year level. There are several compulsory foundational courses that students must register for and complete during the program. These include an academic orientation program, otherwise known as UPO 101, for all first-year students. A scaled-down version is also presented to students entering at a second-year level at the Onderstepoort campus, where UP's Faculty of Veterinary Science is based, at the start of their academic year. All first-year students are required to complete the prescribed academic literacy module. Finally, each student needs to complete the hospital orientation program before the respective clinical work integrated learning program begins. Several themes are horizontally integrated per year throughout the duration of the program. The first year of your coursework therefore provides a natural science foundation and is presented at the Hatfield campus. From your second year onwards, all coursework is offered at the Onderstepoort campus. It is during your second year that you will deal with the theoretical and practical skills training on the normal animal and its environment. We focus on disciplines such as anatomy, histology, microbiology, and physiology, along with modules in animal science and pasture science. In the third year, the training focuses on the causes and effects of disease, including modules on infectious diseases, parasitology, toxicology, pharmacology, and organ pathology. During your fourth year, you will focus on skills training in clinical veterinary medicine and will therefore be introduced to modules aimed at diagnostics and therapeutics related to the individual animal patient. Skills training in clinical veterinary medicine continues into the first half of the fifth year, during which the clinical modules include population-level veterinary medicine. During these semester-specific species-directed modules will also be presented to you. Similarly, vertical integration occurs across the years of the program's duration, which gradually expands your skills in the following areas: veterinary professional life, research and evidence-based veterinary science, clinical skills training, curricular community engagement and extramural studies, as well as pathology. The last 18 months consist of clinical work integrated learning in core and elective veterinary practice. It is during this stage that you will focus on experiential training in the academic hospital as well as in the satellite and other approved facilities. During your final year, you will also compile your research report. The BVSC curriculum consists of a blended learning approach to develop students holistically. While the majority of your program takes place at the Onderstepoort Veterinary Academic Hospital and its satellite community clinics, you will also be exposed to private practices, state veterinary services, commercial and small-scaled farms, abattoirs, and various other related industries. Veterinary science at UP provides a spectrum of exciting opportunities for a career in biomedical sciences and animal health. For more information on the curriculum, visit www.up.ac.za/Faculty of Veterinary Science.
Hi everyone, I hope you learned something from the BVSC curriculum video. My apology for that. With me here, this is Bella. Unfortunately, Bella can't talk. Yeah, but if you come to OP, you get to see Bella. So yeah, just a reminder, please send us your tweets on Twitter, and don't forget to put hashtag I want to be a vet. So we are enjoying your tweets so far, and I'm just encouraging everyone to continue sending your posts. And again, don't forget to follow us on Instagram at OPVSC. So good news, throughout the rest of the year, we'll be sending and posting good stuff on our Instagram page. So you don't want to miss those stuff which we'll be posting on our Instagram page. So please do follow us on our account. Upcoming is the BVET Nurse Curriculum Program. It's all about the nurses program, so enjoy.
Veterinary nursing requires a dedicated and motivated individual with particular interest working with animals and their owners. The BVET Nurse degree is a professional 3-year bachelor's degree offered by the Faculty of Veterinary Science at the University of Pretoria and accredited by the South African Veterinary Council. The degree involves scaffolded learning. This focuses on 3 areas of progression, namely, general theoretical principles about healthy animals, advanced practical veterinary nursing, and nursing of critical care patients. One of the benefits of the curriculum is that you develop a deeper understanding of the content, which is combined between disciplines to allow smooth transitions from clinical understanding to the application of real-life problems. The blended teaching approach allows for self-development and improvement by means of online learning activities and assessments. In the first year of your studies, you will be introduced to general veterinary and basic nursing principles with a theoretical and practical component. The modules will include foundational veterinary sciences, primary animal healthcare, veterinary nursing practice, clinical veterinary nursing, as well as nursing professional life, which carries through to your 3rd and final year. Practical training is compulsory and involves structured supervised practicals, mainly in the Onderstepoort campus skills laboratory, where you will learn through simulations and the use of animal models. The 2nd year advances from system-specific nursing to multi-systemic diseases and intensive care nursing. Once a week, you will have clinical training that consists of rotation through outpatients, isolation, and intensive care unit clinics within the Onderstepoort Veterinary Academic Hospital. You will also perform practical assessments in the skills laboratory. The final year of your degree focuses more specifically on clinical work integrated learning. The veterinary nursing practice module entails a 35-week period during which you are rotated through all clinics in the Onderstepoort Veterinary Academic Hospital and other veterinary institutions. The Nursing Professional Life module assesses whether you have developed the skills and competencies to be a professional veterinary nurse. The BVET Nurse program is a combination of multiple teaching and learning elements. While the majority of the program is offered at the Onderstepoort Veterinary Academic Hospital and its community clinics, it also provides you with exposure to private practices and other facilities. For more information on the full curriculum for the BVET Nurse program, visit www.up.ac.za/Faculty of Veterinary Science.
Welcome back, guys. I hope you guys enjoyed the curriculum videos, the vet and the BV nurse one. I hope all the questions that you had were answered. And if you have any other questions, please don't be shy to send the questions through on the question tab. We will have a Q&A session at the end. So now I want to go to your shout outs. First, we have Lerato with her new baby, Clover. Isn't he so adorable? Is it a boy or girl? Lerato, share with us on the live chat. The next one, we have Annalise with the 2 babies. Can I have one? Please send me your address so I can come fetch my new puppy. Thank you. Love you lots. Next one, we have Annalise again with the cool boy. I love the shades. You should send me the details of where you got them. I think I'm going to change my optometrist because mine is not doing such a good job because he's got bad ones. And then the last one, we have Annalise again with the horse. Annalise, can I come live with you? You look like you have everything that I would want. You're living such a nice life. I'm so jealous. I'm so jealous. Where do you live so I can come visit you for recess? So thank you guys. Don't forget to please tag us, post your little puppies, your fairies, whatever pet you have. We really love to see your dogs or cats, any pet that you have, and interact with us. Keep those chats coming in, keep the questions coming in, and I hope you enjoy the next session.
Okay. That's how you hold the piglet now.
Okay, thank you guys for coming through us up to the end of the session. Just a reminder to follow OPVSC on Instagram. It's at OPVSC, as well as the faculty. So the faculty has Instagram and they have Facebook as well. So their Instagram is OPVets2UP. And then on Facebook, they are Faculty of Veterinary Science, Onderstepoort. So please give us a follow, give us a like. There's a lot of important information and stuff that you guys will see on there. And on OPVSC side, we always collaborate with faculty. So you guys will often see we share the same posts. So it's best to actually like both of our pages, just so that you make sure you get the correct information. So up next, we are going to take some live questions. So just a reminder, please post your questions in the live chat. I will be going through the live chat now, and we'll be having the Q&A with Prof. Dietmar. Okay.
Hope you all enjoyed the videos so far and that you are having a lot of fun. We like the posts. Keep them coming. You can still post your photos with your pets and your animals. It's lovely.
So I have this doll here, and if you've seen Alex replying to you guys on the chat box, this doll looks exactly like Alex's dog. So I'm sure he'll put a photo on there now, just so you guys can tell us if I'm right or if I'm wrong. I think they look identical. Okay, so here we go with all the questions. Okay, so what does TPR and PAM stand for?
Give us a bit of context.
I think with regards to the bandage, probably temperature.
TPR stands for temperature, pulse, and respiration in our language, in veterinary language. So I'm not sure that's what that's.
I think so.
Okay.
Okay, and then would the TPR be the same for a cat and as a dog?
Oh, okay. No, it's not the same. So there are normal ranges of all the critical parameters that we measure, clinical parameters for each species. So as a vet or a vet nurse, you've got to know them all.
Yes.
So unlike a human doctor or a human nurse where you've got one species that you're dealing with, we're dealing with a lot of different species, and we've got to know the information about all of them. So that makes it quite hard, but you get used to it.
Okay, thank you, Prof. If you have submitted your vet nurse value-added form, do you also have to send it in for vet science?
Okay, excellent question. Who asked the question? Have we got a name?
It is Minenhle.
Minenhle, good question. So for that question, you have to fill in the form for both. So the one does not translate to the other program. So if you're applying for BVSC, we have to receive a value-added form for BVSC, and if you're applying for BVet nursing, we have to receive a BVet nursing one. So if you're applying for both programs, you have to complete 2 value-added forms. Very important.
Okay. We have a question here from Karen, which I'm just going to comment on before I let Prof answer. She's asking, are the students allowed access to the labs to practice in their free time? My comment is, what free time? There you go, Prof.
So in this lab where we are at the moment, which is the Clinical Skills Laboratory, there are certain rooms that are open for students to practice during opening times. without supervision, and some other labs that are only with supervision. So it depends on which models and which skills you want to practice. Some of them, as a student, you can come in and you can practice, and others you have to make arrangements for supervision.
Okay, thanks, Prof. So we have a question here asking, what's the difference between a vet nurse and a vet tech?
Okay, we had the question yesterday as well, but I'm happy to repeat because that's an important question. So a vet nurse and the animal health technician and the vet tech, these are all para-veterinary professionals. So they work in the veterinary team together with the veterinarian and with the other para-veterinarians. So a vet tech, as we call them, or a veterinary technologist, so it's not a technician, that's a veterinary technologist. They study at TUT, or Tshwane University of Technology, which is not far from us, about 10 kilometers from the OP campus. And they are the people who work in the laboratories. So they support the veterinarian by doing all the blood tests and other tests, bacteriology, virology, many other tests in the laboratory. That's their function. It's also an exciting career, although you don't work at the cold face with clients so much. Your clients would be the veterinarian, and you perform the diagnostic tests. So that's very different to a veterinary nurse. A veterinary nurse is closer to an animal health technician. So an animal health technician and the vet tech are not the same thing. An animal health technician is the people that support the veterinarian. That's the extension of the veterinarian on farms, in particular for disease control. That's their main function. They do also have a clinical function. So they also support the veterinarian, especially with outreach work and with primary animal health care. But their main function is to assist with disease control. For instance, at the moment, we've got an outbreak of foot and mouth disease in South Africa, and the animal health technicians are very busy at the moment because they have to go to the farms, they have to sample the animals and collect samples and take data and information from the farmers, and then they bring that back to the veterinarian for testing and for interpretation. Veterinary nurse, as we said yesterday, their function is more clinical. So they work more side to side with a veterinarian in a clinical setting. So typically in a veterinary clinic or in a veterinary hospital.
Okay, great, thank you so much. Okay, so we have a question from Crystal asking, will there be an open day at OP for students?
So this program, the I Want to Be a Veterinary Professional program, is replacing the open day. In future, we will still decide in future years if there will be open days again, but for the moment, due to the COVID pandemic, this is our open day.
Okay. Okay, this question, a similar one was asked, but I think there's quite a few asking the same question, so I'll just ask it again. If I'm not admitted to vet nursing program, what other programs or degree can I study?
Yes,
in order to eventually qualify.
Yes, we had the question yesterday. So, what should my second choice be if I'm interested in vet nursing? It can be any program. So, we don't have a specific route into vet nursing as we have for veterinary science. So, somebody that wants to enter vet nursing can take any program as a second choice, anything that you have a passion for. It doesn't really matter.
Okay. So, we have a question asking, what is it like to live at OP Village accommodation-wise?
Oh, you should answer that, not me. I don't live there.
Okay, so I live at residence at OP, and it's basically a mixed residence. There's a lot of students, as Prof did mention. They mix you among the years, and it's a lot more convenient because you can just walk down if you have a test or you have a prac. So it's a lot more easier. Let me know if I answered your question. If not, just ask it again in the chat, then I'll come back to it.
Maybe I can add to that, just to say for people that don't know Pretoria or that are from far away, some of our viewers are very far away from here. So the campus is a little bit isolated. It's outside of Pretoria, about 15 kilometers from the town center and about 20 kilometers from the Hatfield campus of the university. And as such, you're not close to the other students of the University of Pretoria. But it's a very big residence, so there are more than 700 beds, and that forms a community on its own. It's a wonderful community, I think, as an outsider. There are lots of activities taking place, lots of opportunities. Students also study hard and work together and support each other in their studies because they live in the same residence, so that makes it great. There's a nice swimming pool, some great sporting facilities as well. And you have access to the campus, as Jaina said now. So if you want to join the riding club, for instance, you can join the riding club. We've got horses here that students ride. If you're interested in the beagles, you can join the Beagle Club, and you can walk them and play with them and so on. So there are many different opportunities. It's a really rich student life here at OP.
Yes, that is correct indeed. Okay, so this is quite an interesting question. Can you take a local language such as Zulu, considering CCS year? Considering that might be important in CCS year.
I think it's an excellent question. Who asked the question?
It is Thais.
Thais, that's a brilliant question. And we've been struggling to get that included in our curriculum. We've been trying to get something in the curriculum to support students with language, especially for the CCS year, but generally speaking as well, to make it easier for our students to communicate with the community. At this stage, we don't have a fixed module in the curriculum to require that, but it's something that we're still working on. So we would like, as a faculty, to bring this in future, to have a language elective or language subject of choice somewhere in the curriculum. One of the things, interestingly enough, that we've been struggling with or not being able to make a decision is whether that should be in the first year or right at the end. Because maybe in the first year, you're a little bit younger, it's easier to learn a language, but towards the end is actually just before you will need it. So that might also make more sense. So we're still deciding about that.
I see, okay. Great, so does a strong value-added form make up for a lower APS?
Okay, so a strong value-added form definitely helps you with the selection process, but we do not select based on APS. So APS is just a minimum requirement. You need to have a minimum requirement, minimum of 35 for BVSC and 28 for BVet nursing. But that's not considered for the selection itself. For the selection, we look at mathematics, physical sciences, and English in the case of BVSC. And in the case of nursing, we look at mathematics and English. So it's those ones that count, and then the value-added form as well. The value-added form counts 20% towards the selection. So a strong value-added form will make up for a slightly weaker academic score in one of those subjects. That is true.
Okay, thank you for that. We have a question here asking, what animal did you have to face that you were scared of, and how did you deal with the fear?
Oh, you can go.
Okay, I'll go first. I haven't gotten over the fear yet, but interestingly enough, I am afraid of cattle. I was kicked in my second year at one of the outreaches, and I broke one of my fingers. And until then, I'm still a bit scared of them, but obviously I do have to work with them. So it's getting better the more I work with them. Interesting that I'm accompanied by Prof. Holm, who's an expert with cattle.
It's often like that. When you have a bad experience, you become a bit frightened.
Yes.
And in our careers, you often get injured. It does happen. I've been bitten by dogs, by cats, by small little rodents and so on. And I've been kicked by a horse, I've been bitten by a horse, I've been kicked by cattle many times. So you do eventually get resilient.
Yes.
That's the key word, that you need to be resilient. And you need to also learn how to avoid that. So we do emphasize that in the curriculum as well with animal handling. And the key thing there is really, well, two key things. One is safety for us, and the other one is safety and welfare of the animal. So those are the two things that we're concerned about with animal handling. The more you practice it, or the more time you spend around the animal, the better. A lot of people are scared of horses. I think Tulani said that he likes horses. Yeah. Tulani is tall. He's a tall guy. That helps, because a horse is also a big and tall animal, and horses can be a bit dominant sometimes. And you need to, it takes a certain personality with a horse. I personally grew up with horses, so that was easy for me. But I think often students are a bit frightened of horses, and the only way is to work with them a lot and to learn how you should, as a person, dominate the horse. So the horse must know that you are the boss, and not him or her. Otherwise, it's going to end up in the wrong way.
Great, okay. Thank you for that question. Very interesting question. Okay, so we have a question here asking, when doing a BSc and transferring into BVSC, do you have to study at UP or can you study elsewhere?
When doing a BSc and transferring into BVSC, you can study at UP or at another university. And you will see in the brochure that's on our website, so I'm just going to mention that again. Please check our website, which is www.up.ac.za/Faculty of Veterinary Science. And you will find the brochure there for selection for the 2023 intake. And there, in the brochure is a table with all the numbers per category. So we've got different categories or quotas, and there are numbers in each. And you will see that there are more numbers that we take in from UP's BSc, and a smaller number from other universities, but both of them are possible.
Okay, great. Okay, so we have a question from Nicole asking, what actions would you take or can you take if there were signs that an animal is being mistreated or abused?
Nicole, yes, that's something that we are often concerned about. And as a member of the public, if you are not in a position to speak to the person who's abusing the animal directly, which is often the case, then you can report it to the SPCA, to the local SPCA, or to the NSPCA. So that's your best action. And the SPCA has the mandate to confiscate the animal if necessary, or to take any other action that's necessary, including an arrest is also possible.
Yes.
So that's the best action for you to take.
Okay.
If you don't have access to an SPCA or an NSPCA, you can also contact your local police station.
Okay. Thank you for that. So the next question is, what is the cost of the course?
Okay, so the cost of the courses are also published on our website, and you can have a look there. That gives an estimate cost. It's not like a quotation, but it gives an estimate, and it's around about 55 to 65,000 rand per year for the tuition fee. That does not include the residence fee. So the residence fee is more or less the same amount. So the total fee, including residence at the moment, is roughly 130,000 rand per year.
Okay, where can you study animal health technician or study for animal health technician?
For animal health technician, there are different options. You can study at UNISA or at Northwest University or at Solo College in the Eastern Cape.
Okay, thank you. Okay, so the next question is, do you only work on domestic and farm animals, or do you also get to work with wild animals during your 3 years nursing?
So in the nursing curriculum, we do have some exposure to wildlife. It's not a lot because the curriculum time is not that much, so it's limited, but we do give the exposure, and that is enough to equip you with the basic day one skills as a veterinary nurse, so that if you want to take up a career in wildlife, you will be equipped enough to start with that career. So yes, we do have some exposure to wildlife as well in the nursing program.
Okay, so we have a few questions here. I'm just going to sum them up. It's basically, what makes an exceptional value-added form, or do you have any tips for their value-added form?
Good. Okay, so yesterday we had a similar question, and the secret of that is that we don't want to see you necessarily spending a lot of time with shadowing one particular veterinarian. We are more interested to make sure that you've had the widest possible exposure to the profession, whether that's veterinary science or veterinary nursing. So all different aspects of the profession is to us more important, because we want you, before you enter the program here, to have a very good understanding of what the career is about, so that you can make the correct choice. So that if you realize halfway through, if you've been exposed to different components and you realize this is maybe not for me, that you can rather take that decision before you join us. So that's the key.
Okay, thank you. The next question is, what does a vet specifically do at an abattoir?
Okay, that's a great question.
Yeah.
Who asked the question?
It is from Reynard.
Reynard. Okay, good question, Reynard. So the veterinarian is responsible ultimately for meat safety in an abattoir, but the veterinarian does not inspect all the carcasses that are produced in the abattoir. We also have meat inspectors that are trained to do the primary inspections, and they will then call the veterinarian to inspect certain carcasses that they are concerned about, and the veterinarian will then mostly do the secondary meat inspections. But ultimately, the veterinarian is responsible for the certification of meat for safe consumption by humans. So that's a team approach. So the veterinarian is ultimately responsible, but will not be on the floor all the time for every carcass. They will mostly be involved with the secondary meat inspections and then with the reporting and everything else that goes on.
Okay, great, thank you. So we have a question here from Brian asking, what is the most interesting case you have ever dealt with?
Brian, that's an interesting question. I'll have to think about that a little bit. I would say to me personally, because I'm a specialist in bovine herd health, the most interesting has been herd outbreak cases. Not necessarily individual animal cases, because that's more our approach in bovines, that we are more interested in the whole herd. And I would say an outbreak that I dealt with bovine viral diarrhea, that was quite a long, that's a viral disease that cattle get. And it's a very interesting disease, and it's got a very particular way of presenting in a herd, not so much in an individual animal. And that's probably been the most interesting case that I've had to deal with in my career.
Okay, great. So will there be an interview prior to your acceptance?
At this stage, we do not have interviews, but it is something that we reserve the right to do. So you will see in the brochure that we do describe that there could be other means as well. And it's something that we are still developing. So there is a possibility in certain of the quotas in the, that are described in the brochure that we will have interviews. The problem for us with interviews is that applicants come from all over the country, and it's not always possible to get to Onderstepoort without having quite a lot of costs. So that is one of our considerations, but it is something that we are still considering, and in certain quotas we may decide to do that.
Okay. There's a question here from Anonymous about OP Village, so I'll just take that one. She's asking, she or he's asking, do you have your own apartment or is it more like a hostel? So at OP Village, as most reses, you have your own room, and then there's usually communal kitchens and communal bathrooms. Okay, and then the next question we have is from Lerato. She's asking, are snakes really blind?
Lerato, snakes are definitely not blind. Otherwise they won't be able to bite you so accurately or spit you in the eye like the cobras do. So no, they're not blind.
Okay.
Certain species might be, but generally speaking, snakes are not blind. They've got good eyesight.
Okay, there's very few questions left, so guys, just post your questions if you do have questions. Okay, if you do not require accommodation in Hatfield, but then do require it at Onderstepoort, how will you apply for it?
So when you then come to Onderstepoort, you can apply in your first year to be admitted to the residence at OP Village. When you are a first-year student at Hatfield, we also have, for all students, access to what we call a faculty student advisor. That is somebody that works for the university that helps students with small little questions and bigger questions and problems and difficulties sometimes. And she's available for questions like this. So she generally is able to help you and point you in the right direction and say, this is where you need to apply on your portal. So that's the person to go to with a question like that when you're in the first year. So there's great support within the university for things like that.
Okay, great. We have a question from Brian, and he's asking, will coming from an online high school worsen your chances of getting accepted?
Not necessarily, so it depends on the curriculum that you take, but it's not going to worsen your chances because we do have a benchmarking system that will bring all the marks to a certain benchmark for comparison. So it's not necessarily going to worsen your chances now.
Okay.
As long as your marks are good, of course.
Okay. For application of vet science for 2023, should we submit the annexure for career shadowing of 2023, or should we submit the 2022 version?
You can submit the 2022 as well. We will accept that because it's maybe a little bit of a tall order to expect somebody to do all the shadowing in your matric year when you are preparing for your matric exams, and we also don't want you to spend too much time so that you don't have time to prepare for your exams, because your matric exam remains the most important exam in your life. It's not the most difficult, certainly not when you come to us. Then even your first exam is going to be more difficult than your matric exam, but it is the most important exam in your life, and you've got to take it seriously. So therefore, we do accept value-added form or shadowing forms from the previous year as well. No problem.
Okay. Sorry, I'm just scrolling. Okay, so next question is, I'm currently doing a diploma in equine science at TUT, and for my matric results I have 60% in maths and physical science, but I have a low APS. Will I be considered for BVSC if I apply straight after school?
So if you are currently in a tertiary institution, such as TUT in this case, and we know that course, I think it's a good course that you're in at the moment, then you are not able to apply for a transfer to the BVSC program. You have to be in a BSc program. So when you're in a diploma program, you're not able to apply for the BVSC. So you first need to enter a BSc program, and from there you can then apply for a transfer.
Okay, great. There's only very few questions left, so this is one of the last ones. What is the average percentage of people that get accepted into VET compared to those that actually apply?
Okay, so we had the question yesterday as well, the acceptance rate, and it's more or less 20% roughly, maybe just a little bit below. So we usually get about 1,000 to 1,200 applications in total for the BVSC program, and we admit 190 of those. So it's a little bit less than 20%. Okay. So it's quite competitive, in other words, to apply. And that is why we say in the brochure as well that if you meet the minimum criteria, that is usually not enough. So in most cases, you have to exceed the minimum criteria in order to be successful with your selection.
Okay, thank you. So,
as you guys would know.
Yes. The next question is, what is more important, grade 11 or grade 12 marks?
That's a very good question. Who asked the question?
It is Danae.
Danae. Okay, Danae. Now there's a long answer to this question. So if you're at the moment a matriculant and you are applying now for intake in the 2023 intake for us, then we are going to select you on your grade 11 marks from your school. But you have to maintain your performance in your matric exam. And that's all described in the brochure. I think in one of the last pages, there's a description of the conditional selection. So you are then going to be conditionally selected in the beginning, and then based on your performance in your final matric, you will then be your selection will then be confirmed. Or if you drop in performance significantly, and it's described in detail there what significantly means, then you will lose your place. And if you lose your place, you will be considered again, because we now do a second round of selection in January, as soon as the matric results have been released. And the purpose of that selection is then to fill any spaces that have been created by people losing their places. So then you are back on the list. We don't take any new applications at that stage. So we only take those who have applied before, and then we rank them again, but this time we rank them based on their matric results. And if you dropped out but you still performed well, then you could be selected again. So you could in the same year lose your place and then regain a place again. That's possible, and that's happened to some people before. So if you were very strong in grade 11 and you were right at the top of the list and your performance dropped a little bit but you were still fairly strong, then you can maintain your place, but otherwise you might lose your place. So that's very important to understand. And it's quite sad for somebody to have been selected based on grade 11 and then to lose your place when your matric results drop. So please make sure that if you're a matriculant at the moment and if you had a very strong grade 11, that you have to work towards maintaining your performance in matric.
Okay.
That's why I said earlier, matric's your most important examination, and it will stay like that.
Yes. Okay, so the next question is, as a vet, what is your favorite animal to work with?
For me?
For you.
Very easy, cattle.
Yes, we saw that coming.
Yes, we saw that coming.
Yes.
Yeah, I love being around cattle. I really enjoy their smell.
Oh, okay.
Yes, I love working with them. I love touching them. I even love it when they try and be silly. I do find them quite amusing, but I really enjoy working with them, yes.
Okay. Great. I'll take some tips from you, Prof. Okay, so the next question we have is from Sia, and they are asking, would studying MSc Vet be too challenging after already studying animal sciences?
If studying
MSc Vet.
Oh, MSc in veterinary science. If you are, and after studying, just
Animal
say,
science.
Animal science BSc.
Yes.
Okay, so no, I don't think that's a problem. If you have a 4-year BSc Animal Science degree, you can enter an MSc with our faculty. And it won't be too hard for you. You will be well prepared with your 4-year BSc degree to enter an MSc program at OP. It won't be too hard. I think the 4-year BSc is also quite a tough course, so that's not a problem for us.
Okay, great. So this is the last question that we have on the live stream. I'm currently pursuing a diploma in equine science. Will I be considered if I apply?
Yeah, I think we've had that one already. So no, you cannot be considered for now. You need to first enter a BSc program and then from there apply again. In the case of the nursing program, you can be in the diploma, but you then need to contact us that we just make sure that you are at the correct NQF level. So in the case of nursing, you might be eligible to apply, but not in the case of the BVSC program.
Okay, great. That is all the questions we have from you guys. So Prof, we have a question from our side, our team of students over here. So firstly, we would like you to explain what heart water is, just so that the students understand what heart water is. So if you can just explain to them, so they're not...
This is a trick question.
Yes.
Because I asked yesterday what heart water is. Okay, so heart water is a tick-borne disease. It means that when ticks attach to cattle, they can get this disease. Specific ticks that we get in particular in the Bushveld area, but then also all along the coastline of KZN down into the Eastern Cape and even in parts of the Western Cape. It's a tick-borne disease that mostly affects calves, because in most cases it will be endemic on a farm, which means the animals that live on that farm and that were born there have been exposed at some stage in their lives and they become immune. So we mostly see the disease in young calves. And there is a vaccine for it, by the way, which is not an easy vaccine to administer because it's a blood vaccine that you have to inject into the vein. And then you have to watch the animal until they basically get heart water and then treat them. So this disease is a blood-borne disease that then causes the vasculature or the blood vessels to become damaged, and then you get fluid leakage out of the blood vessels. And it causes mostly central nervous system signs and also respiratory signs. That's what we see. It's quite a serious disease. So often if a calf gets the disease, by the time that it's diagnosed, it's often too late. You need to be very vigilant as a farmer. Most of the farmers that farm in these areas know the disease and they know to look out for it in their calves, and they mostly treat it quickly. So it is treatable if you catch it early enough. And it's an important economic disease for farmers in the Bushveld area because it causes quite a lot of losses.
Okay, great. I'm sure you can guess what my next follow-up question on that is. Do you want to demonstrate to our learners how to test for
Tulani. Okay, so there's a clinical test that we do on an animal that we suspect might have heart water, and we're not sure. And what we do is we try and elicit a tremor or a central nervous system sign. And can I demonstrate on you, on myself? Are you sure? Are you ready?
I think they'll get the full image if you demonstrate on yourself.
So you knock them on the forehead, but quite hard, like you knock the door, like this. And then if it's positive, the calf will go like this. That's how we make the diagnosis.
Okay.
It's only a clinical diagnosis. There's no blood test or another test to confirm the diagnosis in a live animal. We can confirm the diagnosis in a dead animal, but not in a live animal. So this test is the only one.
Okay.
You can also try. No, you must knock really hard, otherwise it
My
doesn't
poor
work.
forehead. Okay, thank you so much for that demonstration, Prof. I think it will stick with all the students. When they get to OP, they'll remember the test now.
Definitely, I'll remember to ask in an exam
Yes,
one day in
please
5
do.
or 6 years from
Yes.
now.
Okay, thank you guys so much for joining us for this session. So we now have a short video to be played afterwards, and then we will then have the closing and remarks after this. Thank you. I'll see you guys after the video.
Thanks for joining.
When I'm done with my studies, I will definitely feel like I'm ready for work, mainly because I had enough time to prepare to be a vet. So we do have like a skills lab where we have models. So we get to practice on models before working with the real animals. Apart from that, our final 2 years, we will be doing clinical work. So we get enough time to consolidate everything which we were taught and to practice every skill up until we perfect it in the hospital prior going to the real world. The veterinary profession itself is so vast, they have a lot of opportunities. So I know some might be thinking like, okay, veterinary science is all about dogs and cats, but there's more to it. You can do anything, ranging from parting meat inspection, game, like working with wildlife. So the list is endless. So definitely I would recommend someone to study veterinary science.
Thank you so much for joining us this week. We hope that you guys have enjoyed the entire program, and we hope to actually see you one day here at OP. Please remember to like our social media pages, so at OPVSC, as well as OP2 Vets UP, that is the faculty's page. So for now, what we're going to do is we're just going to close off by giving you the voucher code. So it is 22533. That is the voucher code, so you can just fill it in. And after you fill it in, you will stand a chance to win one of our vouchers. So please feel free to engage with us in the chat. We will be here for another few minutes. Yeah, we hope that you guys enjoyed the day. Thank you.